Creating a plan and making sure your child's speech therapy goals and all the goals on your child's plan are appropriate might sound boring, but you can't afford to waste critical time on goals that are too hard or not individualized for your child. Today, I'm covering the importance of making an individualized plan for your child or young client, and I'm going to cover 3 ways to improve speech therapy goals. Let's get to it. If you've been following me for a while, you might know that in addition to being a doctoral level board-certified behavior analyst, I'm also a registered nurse. And very few of you probably know that in my nursing career, which started back in the late 1980s, I was always a neuro nurse, and I also worked in a rehab hospital for a year or two. This gave me a lot of experience with developing and participating in multidisciplinary goals when I worked with patients with head injuries, strokes, spinal cord injuries, and other neurologic issues. In my time, especially in the rehab setting, I worked with physical therapists, occupational therapists, and speech pathologists, as well as medical professionals. So we would meet weekly to develop goals, to fine-tune the goals, and to determine when we thought the patient would meet their goals to get ready for discharge planning. So a question I get when I talk about speech therapy, or I have courses, a mini course called 5 Days to More Talking, and I have, the verbal behavior bundle. And so when I talk about language and speech and helping kids learn to talk more or better, a lot of times people will comment or people will ask, are you a speech therapist? So no, I'm not a speech and language pathologist, but like I said, I am a registered nurse behavior analyst with a PhD in leadership. And I've worked with and collaborated with so many hundreds, if not thousands, of speech pathologists over the years. And as a behavior analyst and the author of 2 best-selling books, one called The Verbal Behavior Approach back in 2007, and the more recent book, Turn Autism Around, in 2021, in my books, in my courses, on these podcasts, I outline that I use a behavioral approach to increase pro-social behaviors, or quote-unquote good behaviors, that we want more of, like speech, language, comprehension, social skills, pre-academics, academics, all while reducing problem behaviors. So when my firstborn son, Lucas, had a speech delay when he was 2, he started speech therapy. And his first set of speech therapy goals we got. And I was trying to look for those goals for this episode, but I couldn't put my finger on them. But while I loved Lucas's first speech pathologist, some of the goals were not appropriate in hindsight after more than 25 years in the field. So I know I've made critical mistakes along the way with my own son, and I've seen many situations where speech therapy goals could be improved. And that's why I wanted to cover 3 ways to improve speech therapy goals today. This is from my perspective as a parent and as a behavior analyst, and really it could be ways to improve any kind of early intervention goals, IEP goals, IFSP goals, you name it. If there's a goal, there are ways to improve it. So let's get to the number 1 way to improve speech therapy goals. So what we need to do is we need to work on the right speech goals in the right order, based on a child's assessment and their unique strengths and needs and family values. A common mistake for all different types of therapy goals, including occupational therapy goals, pre-academic goals, or educational goals, is that a lot of times professionals who are busy use banks of goals to pull from. But sometimes when you pull a goal and you think it usually works, It doesn't work for a particular child because they have different strengths and needs. So while the IFSP and IEP goal banks or the BBMAP goal banks may be useful to give you some ideas, it's not appropriate to put goals in place that are not based on the child's age and ability level. So in last week's episode of the Positive Toddler Parenting podcast, which was recently renamed, and we can link that in the show notes, I discussed assessing any child with my digital assessment, which was also newly named the Barbera Early Childhood Assessment, or for short, we call that the BECA. The BECA digital assessment takes 10 minutes and is still free at the time of this recording. I don't know that it will always be free, so you can get all the information and take the 10-minute assessment at marybarbera.com/assessment. So for my son Lucas, back when he was 2, and he got his speech therapy goals, which really dictate what's going to happen in therapy. So while I can't find the actual goals, I can tell you what happened during therapy because I was able to watch. Either I was in the room or behind a two-way glass, which was great. So I was able to watch the speech sessions, and I could see that the one goal that was appropriate for him that she worked on for part of her session was pairing words with preferred activities and getting him to request or demand for items and activities, both because he could see it, because he could echo the therapist, and because he wanted the item. So looking back at these speech sessions when Lucas was 2, there was no, there's no video modules, there's no Facebook, there's no YouTube, there's nothing. There's not even any books that she can point me to. So I was watching intently these speech sessions when he was 2. And the first part of the session looked great. And that's what I would have done the entire time if looking back, if we could. So at the beginning of the session, she would pull out things like bubbles, and she would pair the word open. She'd get the wand out. She'd say, or she'd shake it with the lid on, bubble. And she'd hold the item up to her face, bubble. Then she'd open. And then she'd blow the bubble, bubble, and she'd blow. And then, he might echo in there because at the time when he was 2, he had what I now call pop-out words, where the words would come and then I wouldn't hear the words, and I didn't know at the time, 25 years ago, how to get those words to come out. And the speech therapist didn't know how to get those words out either, but there was a higher chance that the words would come out in these fun activities with bubbles or some other cause and effect toys, such as like the hammer and ball. So she would do the same things. She would label ball, she'd put it down, hammer, 1, 2, 3. And she'd do these kind of fun, they almost looked like, more babyish maybe than, a 2-year-old. Like she would get out the pop-up toy for a 9-month-old. But these are all the materials that I now recommend in my courses and my books, because these really can get kids excited, and kids with speech delays can often become excited, and they can start having these words come out more and more with these sessions that are so motivating and labeling the words up to 3 times. So Lucas, during this part of the session, which only lasted about 5 or 10 minutes of the 30-minute session, would be highly motivated. He would sometimes use his words, but he could also be popping the bubbles, gesturing, reaching up at the bubbles, or if it was like hammer and ball, he could participate by using the hammer and following her lead. So that was great. But the rest of the session, the SLP focused on abstract language concepts that were way too difficult. And here's some of the things I remember. And this is what literally happened during his 2-year-old sessions. But this is also literally what happened when I worked in the early intervention field for 7 to 10 years as a behavior analyst, I would see the same kind of goals that needed to be improved. Hey there, it's Mary breaking in real quick here to share a great free resource. Tens of thousands of parents of young children have already completed the free 10-minute digital assessment that I created. If you have a short amount of time, 10 minutes, go to marybarbera.com/assessment to find your starting point to help children with and without delays or autism. Once again, go to marybarbera.com/assessment. Now let's get back to the show. So some abstract concepts that the speech pathologist was working with Lucas on was my turn, your turn, and other kind of pronouns like my turn, and then she'd do it, and then she'd be like, your turn. But that's a really hard concept, and we didn't really get pronouns down pat for years after he was 2. Another thing she worked on, which was way too hard, was prepositions. Put the corn chip next to the bed of the dollhouse, or on and in. And if kids start echoing these words, on and in and my and your are not the kind of words we want them to echo, at least in the very beginning. During her speech sessions for Lucas, the SLP also had a quantity goal in his first set of goals, included one, give me one versus some versus all. This was super hard concept. And she would put items out and she would ask for different variations of one versus some versus all. And he had no idea what she was talking about. He was just grabbing the items and he would make constant errors. Again, I'm not a behavior analyst at the time. I have no idea. I think the whole session is equally as important, but really only that first part of the session was great. And then finally, she also worked on, she had a pile of flashcards, and a lot of them were like a shoe, a bed, a dog, but then a handful of them were apples. And so she would shuffle them up and she'd say, is this an apple? Is this an apple? Is this an apple? And Lucas was supposed to shake his head yes or no, or say yes or no. Again, way too hard. We didn't master that for years to come after I finally figured out how to do that. I do have I have a few video blogs on how to teach pronouns. I think maybe prepositions, and definitely yes and no we can link right below the show note, right below this video on marybarbera.com in the show notes. You can watch any of those. So I would not recommend making goals that are way too hard. Lucas, what the real goal should have been is that Lucas would start echoing us using these highly motivated activities. And once echoics happen, often the floodgates open and we see a lot more language. So we need to focus on the strengths and needs of the child in terms of language. And we also, in addition to just speech, well, obviously we need to also pay attention and have goals for comprehension, touching body parts, following simple commands, once he gets one-step commands down, two-step directions. And that's really, but they also, speech pathologists especially, should be setting goals and looking at feeding issues, pacifier addiction, failure to wean from a bottle or progress from smooth foods to chunky foods and crunchy foods, using utensils, drinking out of an open cup and a straw. And all of these things are assessed using my Becca assessment, which again takes 10 minutes to complete, where we have you check off about pacifiers and bottles and open cup drinking and straw drinking, which is so important, not just for feeding, but also for language. And the other area that's super important for all therapists to look at is the rate of problem behaviors and the seriousness of problem behaviors. If a child is hitting, biting, flopping on the ground, we can't just do business as usual and focus on a preposition goal. We need to treat the child holistically and treat the family holistically as well. Okay, the second way, the number 2 way to improve speech therapy goals is to set goals to get more babbling, more sound production, and spontaneous 1 to 2 syllable words before setting goals to increase length of utterance for, Timmy to talk in 4-word utterances. That is not a good goal for a child who's not yet speaking or not yet speaking spontaneously. A common mistake I see is people in an effort to get bigger length of utterances. And I know I was super excited about that. As a parent, I thought the more Lucas talked in sentences, the better he would do. And now, after 25 years in the field, I know that that is not true. The more spontaneous and flexible the first 50, 100, 1- and 2-word utterances, the better the child will do. We've done a few podcast episodes with Michelle C., who's one of my coaches now, but she started out as a parent, as an overwhelmed parent, whose 2-year-old was diagnosed right before the COVID lockdown. And she got 2 words from her daughter, Elena, in 1 hour of her language sample. And 33 days later, after taking my toddler preschooler course, Elena's language busted open, and she went from 2 words in that 1 hour time frame to 180 words and phrases with prepositions, pronouns, contractions, plurals, all the things that we all want. But that came naturally. We didn't teach her. It came naturally, and then she was able to really do well and enter kindergarten without any support or any issues. So we'll link some of those in the show notes as well. I also wrote a white paper about Michelle C.'s daughter with my BCBA mentor, Dr. Rick Cabina. We can also link that for free in the show notes as well. I don't believe in pushing length of utterance, adding carrier phrases. I did a video blog on why I don't like carrier phrases, but basically it can really affect not only spontaneous language, like if a child says cookie and their articulation is even clear and they say cookie, and as they reach for a cookie, if you're going for a carrier phrase or sentences, you'll say it like a big boy, tell me in a full sentence. And then that just really affects the spontaneity of language. So then the child says, I want cookie, and then he gets the cookie. It becomes prompt dependent. And if you have articulation issues in a child, like pretzel, and they say pretzel, and then you go put I want in front of that, I want that becomes even more useless. So focus on 1 to 2 syllable lengths first, sounds first, and then progress from there. We did do a great interview with Dr. Barbara Esch, who wrote the ESA part of the VB MAP assessment, and she's brilliant in terms of this 1 syllable, 2 syllable, not word length. Don't focus on word length, focus on sounds and syllable length first to get kids talking. And the third and final way to improve speech therapy goals that I'm going to discuss today is, whenever possible, include parents and other professionals in your goal selection and allow parents to be an integral part of your therapy sessions. I know it was critical when I was allowed to go into the room with Lucas for speech therapy or watch behind the 2-way glass, because I could see what she was working on. I could, really try to take that home, as I talk in my most recent book about becoming the captain of the ship for the parent. And if you have a well-meaning, really gung-ho parent, get them involved with these techniques, because then they can be working on those during all of the child's waking hours, which is so critical. Parents are their child's best advocate. They're going to be there in the short term and the long term, and we should embrace that, and we should really empower parents to be as involved as they can be, as they want to be, and also network with other professionals like behavioral professionals and occupational therapists to make sure you're not setting a goal that they are setting a contradictory goal. Wherever you're living around the world, whether you're in the United States and your child has an IFSP or an IEP, or anywhere around the world and your child has expressive and receptive language delays, if an insurance company or a school district or someone else is paying for some kind of therapy, whether that is speech therapy, like it was for Lucas early on, or whether that's a full-time ABA clinic setting or school, wherever your child is going, if some organization is paying for those services, you will have to have an assessment, you will have to have a plan, and you will have to have goals and data on those goals to make sure that the child is making progress. And this is the only way to know if therapy is working. But with or without professional help, you can use my 4-step proven approach to assess, to make a plan, to teach in a positive, child-friendly way, and to evaluate using easy data. So that's all we have time for today. I hope that you complete the Becca assessment. Again, marybarbera.com/assessment. And that will really help you look at finding your strengths and needs for your child and making that plan. And I hope you found some wisdom in these 3 ways to improve your speech therapy goals or other goals for your child. And I'd love your thoughts on the episode. Leave a comment, give us a review, email us at info@marybarbera.com. And if you found this helpful, I would love it if you would share it with another parent or professional who might benefit. I'll see you right here, same time, same place, next time.